Good morning, Brother Dino. How are you doing?
Yes, good morning. I'm doing so well, Sister Audrey, and it's just wonderful to me now. And what about you? How are you doing there?
Well, I am doing wonderful since I see you back.
It's true, you are looking much more beautiful now.
Thank you so much for your compliment. You are so handsome yourself. Our scientific dialogue topic for today is schizophrenia spectrum, isn't it?
Yes, correct. And schizophrenia is the most stigmatized mental illness in the world.
Okay, what is schizophrenia anyway?
First of all, we have to understand about the terminology of schizophrenia. Schizo means to split or to lose, while phrenia means the mind or the thought. So the patient with schizophrenia, they do not have the normal mind or normal thought because they cannot differentiate between the reality and non-reality, and it's because of the psychosis and also the disorganized speech and disorganized behavior. So the core symptoms of patient with schizophrenia are having the delusion or hallucination and disorganized speech or behavior.
Why schizophrenia happens then?
Well, actually, there is no exact cause, but some studies show that there are two reasons for patient with schizophrenia. Those are the prenatal happenings or prenatal condition and postnatal conditions. And the prenatal conditions is such as low nutrition and then the illness of the mother and then the low weight birth and then also the abnormal shape of the body of the baby. And about the postnatal one is such as the child abuse and also the torture about um, mind during the childhood.
So, when does schizophrenia typically happen?
Well, actually, the people, or especially the parents, can tell or realize that someone, or I mean the children, is suspected with schizophrenia during childhood and adolescence. But due to the doctor cannot punish the children or adolescents before 18 years old, so the onset age for patient with schizophrenia is after 18 years old, and the women is more prone for schizophrenia than rather than male than men. It's because the women are more prone to be the victim of physical abuse rather than men.
Then, what is the difference between positive symptoms and negative ones here?
Alright, before talking about the positive symptoms and negative ones, we have to understand that there are three categories of symptoms in schizophrenia. Those are the positive symptoms, and then negative symptoms, and then the cognitive symptoms. And in positive symptoms is also called psychosis. In psychosis, there are several symptoms such as the delusion and then hallucination and also actually with the illusion as well. And the other one is the disorganized speech and disorganized behavior. And the negative symptoms is such as the low mood, and then the anhedonia, then the abnormal pattern of eating and sleeping, and then the inability to keep the self-hygiene. In cognitive symptoms, those are such as the inability to think rationally, or the thoughts are too much irrationality, and then inability to do the simple maths, and then also the disorganized speech and behavior, actually also the product of the low cognition of the brain or the mind.
Tell us the difference between negative symptoms in schizophrenia and ones in major depressive disorder.
Actually, it's a rare condition for the people with schizophrenia having the negative symptoms or express the negative symptoms. Sometimes it's because of the side effects of the medication, and then the patient suffer the negative symptoms. But most of them are unable to express the negative symptoms or the low mood to the inability of the facial expression, and it's called the flat affect. And then the the patient really cannot express or do the mood expression. So despite having the negative symptoms or upset reality, they still have the normal expression of the face, or flat expression of the face. While the negative symptoms for the patient with major depressive disorder, they cannot express the good mood condition, or they cannot have the good mood. It's because the neurotransmitter makes them feel gloomy or feel low mood. Especially, it is called anhedonia. And so whatever happens, whatever good news they have, they still have the negative symptoms and keep expressing the low mood or the extreme sadness. It's because the product of the neurotransmitter having too much fight and flight response.
By the way, is it possible schizophrenia can be led by other mental illness such as major depressive disorder and post-traumatic and stress disorder?
Well, the major depressive disorder with the chronic one can lead to schizophrenia, as well as the post-traumatic and stress disorder. But actually, those are not the direct cause. But the direct cause are the neurotransmitters such as dopamine, serotonin, and oxytocin, and those are produced too much inside the central nervous system. And too much dopamine, serotonin, and oxytocin can lead to the psychosis or positive symptoms that lead to schizophrenia, and it creates the delusion, hallucination, and easy to get delusion.
Then, tell us the common triggers of schizophrenia. Are there both primary ones and secondary ones?
I think so. There are two categories of triggers for schizophrenia illness. Those are the primary ones and then the secondary ones. Well, the primary ones, those are such as the low nutrition during pregnancy, and then the poisonous food during pregnancy, and then some happenings that hurt the baby during pregnancy, and then the premature birth, and then the abnormal shape of the baby, and then hyperweight or too small shape of the baby. And then the postnatal one is such as the childhood trauma or childhood abuse, child abuse, and then what we call also babyhood abuse, the torture of the mind during babyhood and childhood. And then the secondary triggers of the schizophrenia is the upset reality that hurts too much for those patients, and then also some major depressive disorder that happens too much, that cannot be resisted by the patient. And then also the post the post-traumatic and stress disorder also, about childhood and affect the adulthood, that lead to schizophrenia illness.
Eventually, how are the remedies or medication for the first aid and total healing?
In my opinion, the first aid is treat them, I mean the patient with schizophrenia, treat them with gentleness and care. And after that, we help them to the self-hygiene or self-cleanliness. And then after that, we ask them about something that they want. But before we give the reward, we ask them to do something to make the physical activity and mental activity. And while the total healing system is in group, we help them do something among physical, mental, and cognitive to work. Physical thing is like somatic therapy, like exercise, like or sport, while the psychological therapy is by giving the care and carry the care and talk and being friends. And then the cognitive therapy is like doing something like the maths, and then we give the reward, and it's continual for many days, many months after or even some years. Anyhow, I cannot recommend any drug medication myself because I'm not the doctor. If you want to know about the drug medication, you can ask your doctor or the rehabilitation center around you, or about the pharmacies or pharmacy products. You can ask them yourself. Thank you for listening to me.
Thank you for being here and for the well-done knowledge sharing, brother. I am much helped in studying psychiatry by you, my brother.